Just, I pledge allegiance
Pledge
to
allegiance
the
to
flag
the flag
of the United States of
United States
America
of America,
and to the
to the
republic
republic
for which it stands, one
one
nation,
nation,
under
under
God,
God,
indivisible,
indivisible,
with liberty
free
and justice
and
for all.
justice for all. We lost Marie, David.
Yes, we did. I'm not sure why. Maybe Ian can track her down. She looked like she was in office. Was Marie going to be the one taking minutes?
And I'll do that, David. And Ian's recording it, so if what I don't catch, I can, because if I have to board my flight, I
Oh.
can get the recording.
Well, thank you for that.
No problem.
In an airport en route, I'm impressed and grateful. Taking minutes is something I never really caught on to how to do, so I'm incredibly grateful. I should explain that I'm running the meeting because Linda finished and I was vice chair. And the first order of business that we will have is to, I call it reorganization of board, essentially election of a chair and vice chair. The quorum is adequate to do that. I'd love to give Maria a chance to get back on and Joan a chance to join us. So if people online on the meeting now have had a chance, anybody's had a chance to review the minutes and wishes to move for approval of the minutes, we can take care of that.
I move for the minutes to be approved.
I second.
And by acclamation, are there any objections?
No,
Any changes or modifications that anybody on the line might wish to make?
not that I see.
Okay, excellent. So minutes have been reviewed and approved. So now we are a little bit stuck because the remainder of the items I think require proceeding as a board in entirety.
Do you want to send her an email? Let me send her an email real quick. Maybe I can invite her. I'll send her an invite, see if she gets it.
We're talking about Joan?
Yeah, no, to Marie. Oh, you want Joan? Let me
Joan
see
and
if I can do that.
Marie.
I sent one to Marie.
You sent one to Marie. I'll try
Yes, I did.
to send one to Joan. Let's see if I forward this to Joan Capuzzi. And send that off. I don't have any email suggesting she's not joining us.
If we may open for discussion here, members of the board, I want to hope that board members attend meetings on a regular basis. And I think that there are board members or member or whatever that have not done that. And I wonder what we can do to make that change, or do we have the power that, in a bylaw saying that board members must attend at least 75% of the meetings or something like that? Is because, I mean, we can't function as a board if we don't have people participating in it. We all have our private issues, so it's not expected that everybody should attend every meeting, but they should be able to attend the majority of the meetings, and if they don't, then they should not be participating on the board.
Well,
So-
I think we had multiple members resign. Am I right? So
I don't know that.
Yeah,
had,
Linda, Paul's off, Amit's off. Linda, of course, ended her term.
Right, so
So we're-
three I'm sorry, Kathy, go ahead, please.
Go ahead.
3 people, Amit and Paul both resigned.
Okay,
Linda finished. That would have had us at 9, but I think we lost one other member, didn't we?
well,
I think-
Linda,
Linda,
Paul, and Amit. And I think we were down to 9 from 10. Charlie, you remember? I don't. But I think we are constituted to be up to 10, which is why quorum is 5.
right,
And I agree completely, Jane, that if you're going to join, commitment should be important.
right.
So I guess we can, without disrupting the agenda too terribly much, we can have the discussion of Board of Health future, which I think the issue that you raise is a discussion of Board of Health future.
Right,
The fact that we've lost 3 members over the last couple of months may reflect the fact that that service on the board is not. Marie's back.
hi, Marie.
Marie, you with us?
She's still on mute.
Marie, unmute.
That's weird.
I'm guessing she's having, couldn't see whether she was home office or in
She
the
might-
building. I'm guessing she is having connectivity problems.
She must be in transit maybe somewhere.
Could be. But to get back to that, so I have had concerns myself over the last year, during which we've seen the most sorrowful, impactful, enervating public health crisis that hopefully any of us will ever see in our lives. And we, as the Board of Health, have been not been in a position to have a lot of impact for the township with regard to the Marie. We did a call to order, a pledge of allegiance, approval of minutes. We were
Perfect.
waiting to see if Joan would come in to do the election, and Jane raised a very, I think, telling and important point, which is what should be the obligation for people who are members of the board to attend the board meetings, and one step beyond that, how would one go about enforcing any obligation one might make to a voluntary position on a board like this? So with Joan not here yet and with you off, I kind of jumped to the new business and discussion of future, and was about to point out that I have real concerns about the future of the board. And so I am thrilled with the dedication demonstrated by those who are on. And I think it is a core of individuals who has done a great bulk of the work. But I think there are a couple things that are going on I don't want to ramble on. And I think one of those things is that the demonstration through the pandemic that the absence of a county-based Board of Health has essentially put Delaware County in a really bad position. And that does not mean that I am not grateful to our neighbors in Chester County for what they have done for us. But when push is now coming to shove, I would say in the 5-county area, there is no county further behind than Delaware County in the immunization program. And Jane, go ahead. I'm talking.
Yeah, I'm sorry. I can speak to that because I've been working.
Can I
Sure.
I'm so sorry that I'm late and I do not
No,
mean
no.
to interrupt. Because I don't know if did you guys elect a chair and vice chair yet?
No, we
No.
were waiting for you
Okay,
to be
so that
present.
has to be the first order.
All righty, so let's
for
get
any
back to the
township
order.
talk. I am so sorry to interrupt
That's
you.
fine.
So if you're
So,
Jewish, let's get back to the Seder of the Seder, which is the order of the order, and get back to the order of the agenda and have an election of officers.
Okay, I'd like to nominate Dr. David Simmons as our chair.
Thank you. That's kind, I think.
I would like to second that.
Thank you.
All in favor, say aye.
In the absence of any other nominations, no other nominations, we can save people the embarrassment of having to vote by acclamation if there's no other nomination. So now we come to a different issue, and we need nominees for a vice chair.
Well, maybe we should ask, is anybody interested in doing that?
Great question. Jane, you interested?
No.
can
Thank
do
you.
it, David.
And I appreciate it. But who said they can do it?
Kathy can do it. I'll do it.
Oh, great. Okay. I nominate Kathy Dewar as vice chair.
Second.
Just behave, David.
And I suggest that we approve by acclamation.
Okay, great.
All
Done.
right.
Thank you, Marie.
Thank
So
you.
now we've reorganized the board. And,
Now, David, you can go into your speech. Go ahead.
no, I think let's go back and do by order. Let's go ahead and hear the health officer's report if we may.
Again, I apologize for interrupting. I had
You don't need to apologize. It's not an
No.
interruption, and we're thrilled with the support that you provide for the board.
So I'll give you just a short, brief report. So we did extend the staff and building protocols. They were due to expire on the 15th. We extended them through January 29th, and the OEM will meet, a few days prior to that to decide if we're going to continue that. So the windows are all closed. There's very limited public allowed in the building. They do the drop box still in the lobby. It's contactless for the most part. Even though all services are up and running, it's very minimal contact. We're still at 50% staffing where possible here. So that'll go through the 29th. I guess I'll touch briefly on with all the vaccine kind of information coming up. That's obviously confusing, and this is a very tall task. We are receiving calls here through OEM and through health, and we are just really, what we're doing is just staying consistent with, encouraging people to go to the Chester County Health Department website, monitor that page. They do a really good job updating it. The vaccine interest survey is up and available, although they're changing the phasing, seems like almost daily, if not every other day. Our focus was on the older folks that don't have internet or don't have cell phones. So those calls are coming in, and we are assisting them as best we can with helping them fill out that vaccine interest survey.
When you say we, who is the we?
So myself and so we're down a man here. So Katie, I don't think she made it to the meeting. She's been out for a while, but when she's here, she does it. And then also some other members of the Office of Emergency Management. So Sergeant.
So is this a township function, or what governmental level is this function?
So you mean handling the public health calls that come in? So that usually falls in health under community development. So Katie and I typically handle all those public health concerns. We haven't.
But the site is a Delaware County site.
So the vaccine interest survey is linked to the Chester County website. So no, we do not have any affiliation with that. We are merely supporting and encouraging our Radnor residents who are part of Delaware County to utilize that site for all their information. What we do here in Radnor Township is really just encourage folks to go to that site, or we'll assist them in filling out the survey. I do it for them when they call me. So that's really kind of our role right now with that, is providing information or pointing them in the direction to get the most recent up-to-date information. And then I guess, I don't know if anybody saw, actually, I don't know if you guys would be available. There was a Delaware County vaccine update for municipalities today at 3:00. there wasn't a whole lot of new information that was given. Just a few points that came up is they have designated 3 sites for the appointment only vaccinations that apparently have not begun just yet. And those are people in the phases. They are emphasizing over and over again that they just don't have the vaccine to begin those appointments. So those sites are, I believe two are in Yaden, or one's in Yaden, one's in Chester, and the other one is, I believe, Aston. So those sites are designated, but they have not begun. They are also contemplating or deciding on the mass distribution sites, but they have not set just yet. And that is clearly going to be down the line. They did say today that they are setting up a call center for all the folks that either don't have internet, don't have a cell phone, are entirely confused. So they are supposed to get that call center up and running by Friday. So they're supposed to distribute that number, by Friday. So, they didn't say a whole lot as far as, when the vaccine is coming, but they just don't know. So that's really the update that I have tonight.
So that's both a health officer's report and to some extent a COVID update, which is not surprising that they overlap. But I asked Marie if we shouldn't put a COVID update as a standing agenda item, not
Absolutely.
necessarily fixed with regard to linked to the health officer's report, but linked to the health officer's report. And for anybody else on the board who might have a contribution about a COVID update that they think might be important for the rest of the board to hear. And I'm just going to go take a second and go Billie Holiday on everybody and say, God bless the child. The fact that there has been no Delaware County immunization program is a God bless the child moment. Chester
Yeah.
County has been wonderful, but I'm sorry,
No.
Jane, go ahead. You were going to
Yeah,
take that.
I don't know. Oh, there I go. I am a volunteer for Citizens Corps of Delaware County, which is a group that is well over 1,000 volunteers. And I must give a kudos to Ed Klein, who runs this program. He's done an amazing job. We are starting tomorrow, Tuesday, Wednesday, Thursday, Friday, to immunize the 1As and starting with the 1Bs. And this is Delaware County. Obviously we have to report to Chester County, but Delaware County is in fact, through the CCDC program and the Medical Reserve Corps, has done an incredible job with the COVID testing, and starting tomorrow in Aston, the vaccination process. So we are doing something. I think that this whole thing with COVID has really put Delaware County to say, you know what, we do need a health department, and that's going to happen. I have no qualms about that we will have a health department, but Delaware County is doing really good things.
So explain to me, how is it that a volunteer organization has possession of a vaccine supply for Delaware County's uses? Where did the supply come from?
Because we get it from the state goes to the county, and the county distributes it.
So the state went through the county, not through the health department, but through the government?
It's Delaware County goes through Chester County, who goes through the state.
So Chester County, once again, is bailing us out.
I don't know if bailing us out is correct. We could have an emergency health department or something like that, but our Citizens Corps has really been in the forefront of doing this. So I think to say that Chester County is totally responsible for this, no, I think Chester County serves as a liaison between Delaware County and the state. Not to say that they haven't helped us out. The only reason they've helped us out because we don't have a health department. But I think given the fact that we don't, that we've done an incredible job with this. Last week at the call center, we started inoculating, including me, medical volunteers and people at the call center. So
Who's-
So I just found out about CCDC through friends who linked me to the patch.
really,
Yeah.
huh?
I don't want to get too distracted on my opinions about the rollout of the vaccination program nationwide, because that's just not a good place for us to go. But I am incredibly grateful. My friends are CCDC volunteers, and I am incredibly grateful for the work of volunteers.
Well, they also have, there's also paid people that are involved. It's not all, I probably would say 80% volunteer. And
And if you want to volunteer to be part of the vaccination team, there was a survey for that as well out.
Right.
So Jane,
So that's still open if you want to volunteer.
How are they determining who's getting the 1B grouping?
well, it's based on what the protocol is for the state, because each state varies on who they want for.
And changes every day.
Yes,
Right.
it does.
So their
Right.
update,
It's
They had
changing
a-
every single day.
they had during their update today, and this is not a ton of information, but the county had said that because the state had, put the majority of our population in that 1A group, like there's a
Right.
huge chunk of folks that they moved to the 1A group, that the county plans to make their own determination on prioritizing within that phase. They
Right.
did not give any details about how they were going to do that or what they were going to do, but
Yeah, I'm not privy to that. I just go and volunteer and do my job. But I also understand that Mainline Health is also vaccinating, as well as CVS. I have an elderly mother in assisted living, not in a nursing home, and they do differentiate between nursing homes and assisted/independent living. And they're finally getting their vaccination next week through CVS. So I think there's several modalities that are working, not necessarily together, but more independently to provide these vaccinations.
So I'm thrilled that there are actually people working to provide the vaccinations. When I reviewed the vaccination rollout spreadsheet in the New York Times this morning, apparently, although the companies believe that 80 million doses have been provided from the companies to the federal government, the states believe that 31 million doses have been delivered to the states, and just over 11 million doses have been administered. So in those sets of circumstances, it's not surprising that there's a little bit of mayhem out there. But the fact that people are rolling up their sleeves and actually working to get this done is excellent. But the notion that you would restrict, this is a federal policy issue, that you would restrict into groups when large portions of the groups are not making themselves available for vaccination becomes another question,
Right.
especially when you have shelf life issues, which you have for both of the two vaccines. So and nothing that we can do this moment about that. I think, Jane, as you point out, every day you get a call and it's a different set of
Right.
guidelines, right?
I mean, the intent is to have what they call VPODs, vaccination points of dispensing, multiple numbers in Delaware County. And Marie did say that Yaden, Aston, and they're even looking, and, don't quote me on this, Delaware County Community College. There's so much logistics that is involved in this that, they have to do their due diligence in order to make sure that everything functions, because, it's incredible what you have to do. They have to register,
Right.
Then they come in and you have to go through all the questions and make sure that this person is a good candidate. You have to put them into the system, and then I mean, there's 3 points where you actually ask medical questions. And then finally you give them the vaccination, then they have to go to another room where for the majority of people, they sit for 15 minutes. And there are some people that are, we would consider sort of immunocompromised or have had other issues, allergies and stuff like that, that will have to sit for 30 minutes before they're released. But it's very complicated. It's not just a straightforward thing where you just go in and somebody hits you with an injection and then you leave. And everybody gets a card with their name, date, and when you leave, you always are given another appointment for when you come back to get your second dose. And then you can go to a program that CDC has where they can, if you so choose, they will track you.
Be safe.
Yes,
Be safe
exactly.
website.
Which I like highly recommend, because you're giving more data to
Bingo.
a product that has, been pushed through. And, I tell everybody that we vaccinate, please go on VSafe. Please do this because you're helping yourself and you're helping others. So I'm a big proponent of that.
Well, thanks for that, Jane.
Sure.
I still say that systematically it's a big stinking mess out there, and we need to get as much vaccine to as many people as we possibly can. And again, thank you to you and the organization and the people that are volunteering. Anybody else with any other COVID updates they want to bring up? And as I look at the agenda, I do not believe there are any open old business items. Right?
Nope.
Anybody aware of any? Kathy?
Nope, not that I'm aware of.
All right, so we can check that off. And so that brings us to the student interns project update.
I just want to say, guys, this has been so difficult for you, and my heart goes out to you because I don't know how you do. They try to contact teachers or counselors, and they don't necessarily get back to them. It's very different when you're trying to get to somebody online as opposed to going into their classroom or into their office to try to access them. So I just, as I said before, just keep this project as simple as you can. And we know that you have so many obstacles that you have to deal with this year. So, just do the best you can to give us, something unique and different, but don't make it like, something that shatters the world.
Yeah, so we did actually get back from one of our guidance counselors,
Yes.
and she gave us a lot of good information about students coming to talk to her one-on-one and how comfortable they are with talking about their own mental health. And so we weren't able to talk to one of our health teachers because she actually never responded, but we reached out to Dr. Kearney, the assistant director of teaching and learning in a previous Township wellness study. So we wanted to know if he had any experience with mental health curriculum. So we're looking to get back from him. So that's where we are so far.
And so where do you think you're going to take this? What is it that you would like to accomplish?
So after this feedback, we wanted to find out if there was any way we could incorporate student feedback, but I'm not really sure if that's possible, through like a satisfaction survey with the way their mental health education is being delivered to them. So that's what we wanted to do.
Yeah, because I did look at the Journal of Adolescent and School Health that you recommended, but I think there's a dearth of information regarding the way that the health curriculum is taught, and usually when talking about teen health, it's mostly talking about substance use or sex education or mental illness, not necessarily talking about it in the health classroom. And so I think that maybe we would have to go into our local community and find out that information ourselves
Okay. Would you consider reviewing the literature and just proposing that there is not much out there in terms of, I don't want to say teaching kids about mental health, but counseling kids in a classroom setting about mental health? So what you're saying, there's a lot more information out on other health related subjects and not mental health.
Yeah.
So maybe you can focus on that, and maybe your connections that you have with the Radnor Township High School, they could support that. Or because I'm not sure you're going to be able to do a survey. You know, we've talked about that because of you know, all the laws, you know, regarding privacy and the fact that a lot of students are under the age of 18, and you know, we've run into those issues in the past. So you know, maybe just getting feedback from the teachers and from your review of the literature would be very valuable.
Okay.
Is it possible to interview like a few students? Because I saw I think 2 or 3 years ago, in one of the student intern projects, I think one of the students interviewed someone in her grade.
Yeah, I think that would be fabulous. You just have to put it through whatever committee is in the high school that would either A, allow you to do that, or B, not allow you to do that. So I don't know that answer. So whoever does that in your school, you would have to contact them.
Okay.
All
So
right.
Jane, I think your idea that in the absence of being able to actually do the survey, doing an aggressive examination of the literature to do a more refined job of defining the problem makes an awful lot of sense.
Yes, absolutely. Yep. All right. Any questions, guys?
I don't think so.
Okay, and just know that you're just contact us anytime you need to. Okay.
Okay, thank you.
You're welcome.
Any other comments? Thank you very much, and good luck. It's tough. It's just tough for everybody
It
in
is.
every way. So that brings us down in order to the new business discussion that we were having, and I think I'm going to try and wrap that up pretty succinctly. I'm concerned that that the Township Board of Health is not adequately tethered to the will of the Board of Commissioners, and therefore the will of the people of the township, nor to the biggest issues up until the pandemic were almost entirely residing within the school system and our children. And since the school board is an independently elected entity, we are not adequately tethered to what prior to the pandemic was the biggest source of health concerns and health issues. And that finally, with the advent of the pandemic, in the absence of a county board of health, we're not adequately tethered to the overall public health infrastructure in the state of Pennsylvania, and that has led to a huge amount of frustration on my part with regard to what we do as a board. I vividly remember, I believe it was our last, but it might have been our next to last meeting last year when we had the visitors, actually before we shut down. So we had the visitors talking about trying to establish a Chester County Board of Health. And the last question I asked got a frank answer. And that question was, if there is a county board of health, what happens to the township board of health, boards of health? Their answer was frank. They didn't believe that township boards of health would continue to exist. Well, that's a countywide point of view. There may be a role for a township board of health, even in the presence of a county board of health. But with all of those questions in the air, that has been what I have been working to try and pushing to try and get a better handle on. And I've been doing that through the members of the Board of Commissioners and with the help of Marie. And And that is what I intend to make my major thrust, is to make us more relevant, more focused, and more able to do things that actually address health issues in Radnor Township. So that's my address as the new chair, and I'll throw it to the floor. If other people have comments or insights or other points of view, I'd be thrilled to hear it.
Are you saying that you feel that we're not empowered enough? When you say tethered, can you explain that, please?
Yeah, I think empowered. So we're a volunteer organization without a budget. Okay. We exist as a consequence of a township ordinance, and we serve at the pleasure of the Board of Commission. And I'll go back to the issue about yard equipment noise. And we worked hard on that, and then we took it to the Board of Commissioners and really got cut off at the knees. Well, we didn't really need to put all the work in if that was the way it was going to go. And that represented to me that we weren't necessarily doing the will of the board or acting for the people of the township through the elected board. And we're not elected, we're volunteers. We've had some very interesting and fun conversations, but they haven't necessarily been linked to activities, specific activities designed to promote the health and welfare of the people of the township. They've been informational, they've been well executed. And so does that help?
Yes, it does. Marie, do you feel that our recommendations that we've given to the Board of Commissioners has made any kind of impact? No.
Marie has to be very careful here.
Well, I do think when John was on, there was a little more interaction with the Board of Commissioners. So maybe we need to engage our liaison on the Board of Commissioners and find out a path for us.
Yeah.
That's so my route has been actually had been through my commissioner, and now will expand to the member on the board. It has been, I've been doing this now since August, maybe even earlier, maybe even June, trying to move this forward. And I'm not getting any no's, but I'm not getting any motion. So Kathy, I think that's a great idea, and I agree entirely.
So you think the Board of Commissioners member that serves on our board should be more proactive or more responsive to?
Well, I'd like to ask her opinion before
I mean, we have to get her engaged. She's not on right now. I don't see her on, but
They
we need
they
to.
might change as well. It was Commissioner Mulroney and Commissioner Farhi. There, with all the reorgs that happened this month for all the boards, I think they may update the standing committees as well. So once that list comes to me, I will get it to you to let you know who our standing commissioners are for the Board of Health.
Okay, and then maybe whoever serves on the Board of Health, our commissioner, we could have a one-on-one discussion about the issues that we have faced in the past and see how we can move forward to be more empowered as active members of this community.
I think that's, yes, spot on. Agree completely.
Okay. Okay.
So I think if there's nobody else weighing in on that, I think that you've captured Jane and Kathy, and I think I'm going to push that forward. And listen, if it means having better service for the entire county, and we have to change radically as a consequence, I think one of the things that we can do for the township is help the township enable the county to get a county board of health.
Right. And I don't see us being at odds with a county board of health. I just see us more as a part of that in that we are supporting our particular township and all the needs of our township. And I would hope that other townships would have their board of health that can relate to Delaware County's Board of Health and, discuss our needs. And I don't think we could.
I agree with that. I was a little surprised. the answer I got when the guests were there. But yeah, I think that we could serve as a model or a pilot for other townships, assuming that there were to be a county board of health. Absolutely.
Right. Just a quick question. Are there any candidates for filling those empty spots?
We haven't seen any just yet, no.
And how do you advertise that, for lack of a better term?
I believe it gets posted on the website through the executive assistant. I
Okay.
don't know how often she does that. I think they might announce it at the Board of Commissioners meetings as well, all the
Okay.
openings.
And my ward commissioners posts all the board openings in her newsletter, which is a couple times a month. We
Got
get
it.
newsletters from her, but
Okay. And we also, as individuals, can go out and maybe find people that. we
Yeah,
can-
ask your friends.
Right.
Ask your friends. Yep.
Yep.
so that's actually was one of the other issues that I would. 10 is not a magic number, and this comes back to the very first thing that you said, Jane. I'd rather have 6 committed individuals than 5 out of 10 committed individuals. So I go ahead.
Now, when I was interviewed for the Board of Health, I was interviewed by several members of the Board of Commissioners. Wouldn't you want either the chair or the co-chair to be involved in that?
Yeah, but
I mean, that would make sense. It's like, hello.
Okay.
yes, I think I would put the size of the board and recruitment into the board among the issues that we can take up as we're pushing to get a better understanding and a closer relationship to the Board of Commission.
Yeah, I mean, that would make sense to do that. Okay.
Excellent. We have no public participation, Marie.
Nope.
We have any other issues or items or new business or anything else that we need to take up? If not, may I have a motion to adjourn?
Motion to adjourn.
I assume we have unanimous approval.
Yes, you do, David.
Happy New Year to everybody. Thank you very
Happy
much.
New Year.
Thank you for
Thanks.
showing your support. And we meet in 4 weeks, is it? Or no, a little over that.
Yes, Tuesday.
Yep.
Tuesday,
Tuesday,
February-
after
February.
President's Day.
Right.
And place it is to be determined, right?
Correct. As of right now, we're virtual, but it will be determined.
I'll bet a
Okay.
quarter with anybody here that we will be virtual.
Yeah.
The dynamics do not suggest that we're going to be opening up in the next couple of weeks.
That's true. That's true. All right.
Hello, everybody. Thank you.
Bye, guys.
Congratulations.
Stay safe, everyone.